Good morning. I'm Dr. Ann Trussell from Sabella Med Spa here in Little Rock, Arkansas. I have board certification in internal medicine and most recently in anti-aging and regenerative medicine. I'm the owner and the physician at Sabella and am here 5 days a week. I do most of the treatments myself. We focus on non-invasive cosmetic and aesthetic treatments to try to help you avoid plastic surgery as long as possible. Today we're going to focus on SculpSure. Sandy is here for her first treatment on her lower abdomen. SculpSure is permanent, non-invasive fat loss. It's the newest thing out there, and we can do multiple areas. We can do your lower abdomen, your upper abdomen, your arms, your inner thighs, your outer thighs, the banana roll behind your bottom. But Sandy wants to focus on her lower abdomen today. Now, before I got Sandy on the table, we did her measurements and we took her pictures, which is what we do before each treatment. How many treatments you're going to need depends on how much fat you have to lose. We do treatments no sooner than 6 weeks apart, but you will actually lose fat for up to 12 weeks. So I'm going to hook Sandy up now and we'll let you see what a treatment looks like. So there are multiple applicators for the SculpSure. We have single, double, triple, and what we call our quad applicator. So I could do Sandy's lower abdomen and a spot on her upper abdomen because the laser actually diffuses out 3 centimeters. But since Sandy mostly wants to focus on her lower abdomen, we're going to use this quad applicator that will fit very nicely right between her hip bones. Okay, so there are 4 applicators that we use, and these hook into the little frames. This looks a lot like an octopus. And so when I start Sandy's treatment, it starts out being very cold, and then it goes through cycles of heating and cooling every 30 seconds. And we can adjust the temperature based on Sandy's comfort. Is that good? Okay, now we're ready. And Sandy, you're going to tell me if it gets too warm. So we are about 15 minutes into Sandy's treatment. We have 10 minutes left. She was very comfortable at the temperature we started her at, so I was actually able to turn it up for her. Then when we finish in 10 minutes, I'll give her final instructions. And we're all finished, so I'm going to unhook Sandy, put the applicators back in their cradle, ready for the next patient. And as you can see, Sandy's tummy is not burned or swollen. It's a little pink, which will last for about 15 minutes, and because the applicators have a cooling plate on them, her tummy is actually cool. So the post-instruction procedures are very simple. I'm going to ask Sandy to drink 64 to 80 ounces of water a day. Because we just permanently destroyed fat cells, she's going to need to excrete those. So the more water and other fluids she drinks, the more she'll excrete. And I'm also going to tell her if she can exercise, that will help excrete the fat as well. There's absolutely no restrictions on your activity. She may feel a little bit sore the next day, like she's done some crunches, but otherwise she'll go right on about her business, and we'll have her back in 6 weeks to take pictures again.